As we move down to the mandible, the first one that we'll do is an image that will capture both mandibular canines as well as all the incisors in one x-ray. So with this one, anytime you get doing the mandibular canines or incisors, the tongue certainly is the interference that you worry about. Ideally, it's nice to push the tongue out of the way, and usually you can get your film in place quite nicely. But if you find that the frenulum of the tongue is preventing your film from being pushed back far enough, then you can x-ray right through the tongue. So you'd have your tongue in between your plate and the mandible. So in this case, I think it's going to work out fine that I can get the film in there without having to do that. So I'm going to put paper towel on the opposite side of my film, like that. So for this view, I'm going to get both canine teeth as well as the mandibular incisors. What I'm going to do before I really get worried about a bisecting angle is I'm going to get my cone low enough so that it's centered between both those canines and the incisors. Okay, and you really want to see the cone going straight in the middle of all of them, like with no tilt of the cone. As far as like a tilt this way will make a big difference in isolating those teeth. So you want to work hard to get it nice and low so you see the cone going right in the middle of those 8 teeth. So these are teeth at the front, so where you want to hang out is at the side of the patient. Incisors and canines are in this view. I'm going to use the roots of the canines to estimate my tooth angle. So again, if you use the crown of the mandibular canine, you're going to be quite off with your tooth angle. The mandibular canine in cats does curve distally in the skull, and so that's what you want to think about when you're lining up your angle. So I have angle of the tooth root. Standing at the side, I can see the side of the film or the plate that you want to use. Halfway in between is here, which is your bisecting angle. So now I'm going to take my cone and I'm going to direct it so the beam is perpendicular to my bisecting angle. And again, if I have it lined up properly, if I move the stick, it should be flush with the end of the cone. And that's how I would image the mandibular canines and the incisors all together.